My name's Dr. Gary Sidley. I'm a retired consultant clinical psychologist. And today I'm operating in my role as co-founder member of the Smile Free campaign that campaigns against mask mandates. And I'm delighted to welcome my guest today, who's Professor Benny Spira from São Paulo University in Brazil, I think who's based in the microbiology department. Welcome.
Thank you.
Pleased to have you here. Now, Professor Spira did a wonderful study quite recently that was published in April of this year in the medical journal called Curious. It's an open access medical journal, and it was titled Correlation Between Mask Compliance and COVID-19 Outcomes in Europe. Now, as we know, masks have been a very contentious topic throughout the COVID era, and very polarizing. At one end of the spectrum, there are those that swear by them, think they're very effective and little or no harm associated with them, right through to the other extreme where feel it's ineffective and associated with lots of physical, social and psychological harms. And Professor Spira did an excellent study which was published earlier this year, which throws some further light on that question around effectiveness of masks as far as a viral transmission is concerned. So maybe we could start, Professor Spira, by just asking, can you just very briefly outline what your study involved?
Okay, perhaps I'll start where I started with all this thing about masks. So like everybody else, I was kept without masks at the beginning of the pandemic, and I had nothing against masks. Actually, I wasn't born a mask skeptic. So when the pandemic began, I even came home and I said to my wife, we need to get some masks. Masks were not as available as they are today, so he sewed some masks for us. I even distributed this mask to my students in the laboratory and so on. But then came the mandate. And the mandate in São Paulo, the state of São Paulo where I live, came in about May 2020. And then I asked, well, there is a mandate for masks, but what the science has to say about the masks, efficiency concerning viral transmission and so on. And it turned out that there were quite a lot of studies about the mass transmission, about viral transmission and the effect of masks at this time. I think I'm talking about before the pandemic, right? And we can summarize the conclusions from these works in one sentence. The better the work, the better the study, the lower the effect of masks.
Right. Okay.
And there were quite more than 10 randomized control trials at this time. And their conclusion was that there was no effect at all, or the effect was very small. There was some other studies, observational studies, and so on that had different conclusions, but the best studies showed that there was no efficiency, or almost no efficacy of masks. So I asked myself, why the mandates? Then I wrote a small text, a popular text, not a scientific one, and I tried to publish it in the university magazine. It's not a scientific publication, not a scientific journal, it's just a magazine from the university, and I sent them the text I wrote, just summarizing what I found in the scientific literature. And they said, no, we're not going to publish it. They rejected because it's going to confound the public. I insisted, but well, it didn't work. So eventually I just took this small article and I put it in my personal website, at the laboratory website, and still there. This was in July 2020. And I kept interest in masks. So I took my students in the next semester to make a series of experiments. We asked whether viral transmission in outdoors, in open air, is a problem. And we took, of course, not COVID-19 virus, but we use a surrogate, bacteriophages, which are viruses of bacteria. And we went outdoors, we went outside, and we actually made some experiments about it. And the conclusion was, no, outside, there was no problem at all. The probability of viral infection it's very, very low. So if masks were to work, they would not be needed at all outside, I mean, in open air.
Mm.
And then also after that, I wrote a couple of articles that went into a local Brazilian newspaper. A few people read it, I guess. But then by the beginning of 2022, I asked myself, well, what are the real outcomes of masking? I mean, after we have a very strong wave of COVID-19 in the winter of 2020, 2021, in the Northern Hemisphere, what were the outcomes? I mean, is there any data about it? And I tried to look for it in the scientific literature, I didn't find it. There was some ecological study, we call this ecological study. What happened in some country or in some area if after some implementation or this or that measure? There was some ecological studies about masks, but only at the beginning of the pandemic, in the spring, summer of 2020.
Mm.
But at this time, and when there was a strong COVID wave and masks were most needed at this time, there was nothing about it. So okay, I'm going to do it. I look for the data, and I found the data about mask usage at the IHME. It's the Institute of Health Measurement, I guess, Evaluation, something like this, at the University of Washington. They are very, very pro masks.
Mm.
So they cannot say that they are skeptics, not at all. If you go to their website, you're going to find use masks, masks save lives, all this sort of propaganda. So, the data come from a non-suspicious source. So I gathered the data from this about mask usage at this site, and I confronted the data against COVID outcomes, namely cases and deaths, relative cases and death, cases per million, death per million.
Can I just come in there? Am I right? Correct me if I'm wrong, but what you found as far as different countries' usage of masks was of this really wide span from 5% to 95%, which was a great opportunity then for some research.
That's right. I'm going just to say this. Yes, thank you. Because why Europe? I decided to look at Europe, and that's one of the reasons I look at Europe. For several reasons I took Europe. I mean, I couldn't ask the same thing about South America or I don't know, any other continent or place in the world, but Europe was the best. Why? For several reasons. One of them is data availability and reliability. It's an old continent, very well organized compared to other places in the world, of course, you know better than me. And you had data. You simply had good data, what happened in Europe at this time, not only from the University of Washington, but also other sources. I look also at this private company, Statista. They also had some data, free data, that I could look at it. And it pretty much, it was very similar to the data found at the IHME. So this was one thing, data availability and reliability. The other thing was the population homogeneity. It's a small continent. Europe is a small continent with a shared history of epidemics. I mean, one virus appeared in the UK, it will also appear in Germany and elsewhere, of course. It's a very small continent, very well connected, and they have similar levels of health assistance too. So, okay, another thing. The other thing is the age stratification. The percentage of people, senior people, or above 65 years old in Europe is around 20%. There is some variation. Yes, you have places like Italy with 23%, and you have places like Ireland, they are more younger than this. But there is not much difference. We're not comparing a very young country in Africa to Italy. No, we're comparing all old countries in Europe among each other. And the other thing, this is very important, what you mentioned, despite the homogeneity in the population, there was a very different response to COVID-19 mandates. There were places where masks were mandated very strongly, like in Spain, Portugal, and other places, France and Germany.
Mm.
And there were places that were much more relaxed, like in the Scandinavian countries, especially in Sweden, when you had only 5% of mask compliance.
Yeah.
That's it. And we had, in contrast, in Spain, we had more than 90% mask compliance.
Mhm.
So, well, it was perfect to study, to ask this question, had mask worked? And that's what I've done. I gathered the data, collected it, and run a few code on it, and get some and did some statistics.
Mm.
And what I found was that regarding cases, COVID cases, there was no correlation between the number of cases and the percentage of mask usage. Actually, there was a small positive correlation. I mean, places that mask more, they also had more cases, but this was not statistically significant. So we can't say there was no correlation.
So there was no support for the hypothesis that masks actually reduce viral transmission because your result was not significant. And if anything, it was slightly trending towards the opposite direction, but not
That's correct.
significant. Okay, got that.
So the null hypothesis is the correct one in this case. Masks didn't work. They don't have any effect.
Right.
But then I look at deaths, the other outcome, and it was surprising, for me at least. I found out moderate to strong correlation, positive, between mask usage and deaths from COVID.
Right.
This was quite surprising because I expect to see no correlation, but there was a positive correlation. I'm going to translate it for everybody to understand. So it means that countries that mask more also had more deaths from COVID.
Mm.
This was unexpected.
Mm. Yes.
We cannot say, I cannot say that masks cause more death because from this type of study, an observational retrospective study, we cannot infer causation. Everybody knows this sentence, no correlation, causation is not correlation is not causation. So yeah, we cannot infer causation from this, but it raises a red flag.
Mm. And if that turned out to be a robust finding that mask usage did contribute in some way to harm and mortality, increased mortality, do you have any kind of thoughts as to how that might actually happen? Do you have any kind of sense of how mask might?
A couple of explanations, but again, I cannot say that one caused the other. That should be clear. One of them is in places where masks were more mandated, or they were more common, people felt more safe because masks give a false sense of security. They think they are safe and they mingle and they get close to each other in closed spaces. And that's one possibility, but there is another one. There is a German doctor. They published a paper by the beginning of 2022, this year. And he said that, no, there is another thing, is that masks, sick people sick with COVID that are wearing masks, they're actually endangering themselves because they are, while breathing, some of the viruses, they get trapped in the mask and they are inhaled back into the lungs.
Right.
This worsen the outcome for these people.
Okay.
And this is a possibility. Well, we cannot say that what happened here, but if this is true.
So just to make sure I'm following you correctly, then yes, you found this positive correlation between mask usage and mortality. As you said, that doesn't necessarily mean one's causing the other, but there is this statistically significant association. And when I asked you to speculate about what might be the reason for that, you come up with 2 points. One is that people wear masks might feel safer and therefore take more risk as far as mixing and so on. And the second possible reason was this study from earlier in the year in Germany, where they provided some evidence that wearing a mask actually led to inhalation of virus deeper into the lungs. That's right. Yes. Yeah,
that's correct.
Just so I'm following it correctly. Yes. Sorry to interrupt.
No, not at all. So this thing had to be made clear. Yeah, the clearest as possible. So this was puzzling, of course, and that's the data. I cannot do anything about it. That's what the data showed.
Yeah.
And I think that it warrants a serious investigation.
Mm.
I cannot say that one caused the other, but well, it warrants a serious investigation. Maybe, perhaps masks are causing more harm than good. We don't know.
Yeah. Yeah. Okay. I'm just trying to think of what some of the like pro-mask lobby might say if they were listening to this, and looking at like things that might have confounded your results in some way. And I guess one of the things they might come up with would be that, well, of course, in places where people are dying more and more infected, that comes before the mask wearing kind of thing. But this, yeah, and that's what kind of the contributing. How would you respond to that?
Okay, all right, sure. This is a good question, and it's a good criticism to my work. I would like to share some graphs if it's possible now.
See,
I will try, okay?
okay,
Because with the graph is going to get much more clear. Here, share.
yeah,
Can
yeah.
you see it?
I
All
can.
right.
Yes, excellent.
Okay, so I took here 4 countries. Okay, these are 4 countries from Western Europe. The first one, Portugal. Portugal was the first, I mean, is #1 in the ranking of deaths from COVID at this period, the period that was analyzed. Actually, I didn't say it, but the period analyzed went from October 2020 to March 2021, 6 months. Okay, so Portugal was the worst outcome of all in terms of deaths from COVID. What you see here is the number of cases per million during the 6 months in orange, and in blue, you see the mask usage. You can see that mask usage was already high before the wave became.
Yes.
Before the second wave came. So it was already above 70%. 70% is above average for Europe. So, and it raised a little bit, of course. It raised to 80-something% during the height of the peak, but that's it. And Portugal was, again, is #1 in the ranking of deaths. Then came Italy, the same story. Italy was already masking very hard before the COVID-19 second wave came. You can see it started here, 1st of October. There was already 75% or so of mask usage. And it came to 90%. All right, so it raised a little bit, but it was already very high. The same for Spain. Spain was #6 in the ranking of deaths in Europe, in Western Europe, and more than 90% all over the 6 months. So they were masking before the COVID-19 second wave arrived. And to contrast it, Sweden. Sweden also had the COVID-19 strong second wave, but it never went beyond 8% mask usage or so during the entire period. So you can see here, no, that's not true that that COVID rates preceded mask. On the contrary, mask preceded COVID rates.
Yeah, that's clear. That's crystal clear with that. Thank you. Very clear.
Okay, so that's the power of pictures.
Yeah, absolutely. And another potential challenge would be, what about vaccination rates in these countries? Did that confound your findings in any way?
All right. So vaccination started by the beginning of 2021, mainly in the UK, right? So by the end of March, I look at it, only 3 countries had more than 20% vaccination. 3 countries out of 35 had more than 20% vaccination rates at this time, at the end of my period that I analyzed, right? So it's not vaccination, and included only 1 dose. I mean, 20%. The UK, for example, it has, I think, something like 48% vaccination rate, but including all doses, including even people with only 1 dose of the vaccine. At the end of the period analyzed, so vaccination wasn't really an issue.
Right. Okay.
It wasn't. I mean, it could have been a confounding factor if I would continue the analysis through April and May. So yeah, so I stopped at March 31st. One of the reasons was the vaccination, of course, to avoid this confounding factor.
So really interesting study and throwing up some interesting and quite surprising findings in a way, particularly around the mortality. Do you have any plans, Professor Spira, for further research in this area?
Well, I would love to test the hypothesis of this German doctor, for example. I would love to test it, but I don't know. I really don't know how it could be tested in a convincing way, and to find out whether masks actually, the wearing of masks by sick people actually do harm. I don't know. I don't have any other idea other than that could be tested right now. Again, this was a small contribution. I mean, this paper was a small, modest contribution to the subject. I am a bacterial geneticist. I'm not epidemiologist. I'm not involved even in virology, not at all. But I would love to see, I will not do it, of course, but I would love to see a big or several big randomized control trials to set this thing once for all. That's it. It's I don't know. For me, it's clear. It's clear that masking doesn't have the power that some people think they have. No, they don't. They simply don't. One thing that one of the things I'm thinking about it is that I used to teach for more than 10 years a course about science, pseudoscience, philosophy of science to my graduate students here at the university. I'm very interested in this subject besides bacterial genetics. And what I found out is with the masking, it has some characteristics of a pseudoscience actually, because for two reasons at least. One of them is the one I said before: the better the study, the lower the effect. Well, we find this exactly with some pseudosciences, some alternative therapies. Well, you're going to find many papers showing that, for example, homeopathy has some good effects on, I don't know, different illnesses. But when you look at the best papers, no, they show no, there is no effect at all.
So essentially all the bulk of the robust randomized controlled trials in real world settings tend to all kind of show and suggest that masks are pretty ineffective when it comes to viral transmission.
That's right. So this is one thing that makes masking, I mean, the mass science, a sort of pseudoscience. The other thing is that I read many places and talk to some people. Some people believe in masks because they say, "Oh, it's a barrier." Of course, they work. They are an effective barrier. You breathe, or your viruses get trapped in the mask, or the other way around. So they must work. But when you test it in the lab, you're going to find some good responses of masks. I mean, you're going to find that masks they do work in the lab. Well, on mannequins, but a mannequin is not a person. A mannequin doesn't touch the mask, doesn't scratch the face, anything like this. So you cannot turn a very complex subject as the interaction between people, masks, and viruses into something very simple. It's not like this. It's not as simple as a mere physics thing. You understand?
Beautifully expressed. Beautifully expressed. Yes.
It's very complex. So you cannot. Biology is very complex, and psychology is very complex.
Yes, absolutely.
It's not a physics that it's hard, but it's not complex. It's something that can be understandable, that can be calculated exactly.
Yes.
Not like this in biology. So to reduce it to something so simple is kind of pseudoscientific.
Okay, I've got my eye on the time. Got about a minute left. Finally, just to sum up, from your study in particular, in one sentence, what would be the main take-home points for the people listening to this today?
Okay, so there is no correlation between mask usage and the number of COVID cases all over Europe during the most important time, I mean, when masks were needed actually. And there is unfortunately, a positive, moderate to strong correlation between masking and COVID deaths. So this warrants some serious investigation.
Okay, right. Well, thank you very much, Professor Spira. That is wonderful. Very, very clear and eloquent. And thank you for giving us your time today. Thank you.
It was a pleasure. Thank you.
Okay, bye-bye.